implementation of mental health services. I won't read through all the things, but I'll just highlight the E, to collaborate with healthcare services providers to ensure the best care of persons with mental illness and to protect the rights and responsibilities of persons with mental disorder. Okay, next slide, please. Okay, so this is just a continuation of the functions of the Mental Health Act. Okay, since we are late, I'll just skip this part. Okay, so this is to compare the system that occurs in the United States. So in Ghana, like as I said before, is the government which is the main source of funding, for mental health services, and it does this through the Mental Health Authority, the Ministry of Health, the Ghana Health Service. Okay, other sources of funding for medical conditions in Ghana is through the National Health Insurance Scheme and so on. Okay, but in the United States, the system is a bit different. Everything is implemented through the U.S. Department of Health and Human Services. So they have their HIPAA and health rights, health insurance, social service, and under mental health, it comprises also the social services providers and the health insurance. Okay, next slide, please. So under the social services, okay, so we have programs for people living with disabilities, and this includes the mental health treatment, community mental health, and day programs. And if you go back to what is being done under the Mental Health Act and under the Mental Health Act in this country, it also falls in line with what is happening like in the US. Okay, there's also other programs. We'll just skip all of these. Okay, so funding for social services is mainly through Medicare and Medicaid through taxation. You are heavily taxed. The higher you earn, the more taxes that is deducted from your salary. So Medicare is mainly provides national health insurance for those over 65, those with physical and mental disabilities, kidney disease, and motor neuron disease. And it affects 52 million people 65 years or older, or 8 million people living with disabilities. Okay, and Medicaid is basically national health insurance for low-income people. But despite all of these, there's a big gap in coverage, and the Affordable Care Act was supposed to come and bridge that gap. Okay, so we'll fast forward to so suicide. Okay, so we know what suicide is. So in the UK, the Suicide Act of 1961. It was an act of parliament that was decriminalized. So it decriminalized the act of suicide in England and Wales. Scotland was not included because Scotland didn't have, it wasn't even criminal to commit suicide in the first place in Scotland. In Ghana, Section 57, attempted suicide, like these are the penalties. Okay, so the abatement of suicide, okay, the abatement of suicide, the commission of suicide by any person shall, whether or not the suicide was actually committed, be guilty of a first-degree felony, and whoever attempts suicide shall be guilty of misdemeanor. So it has been decriminalized in several countries, and It's still criminal in Ghana because it looks like public opinion is still on the side of suicide being wrong. So if public opinion seems that, then there's little political will to get that criminalized. So this map just shows a quick outlay of suicide legislation by different countries. In the red, all show areas where suicide is legal. So we'll fast forward to LGBT rights. So same-sex relationships are illegal in 72 countries worldwide. It's also illegal in Ghana. The rights are heavily suppressed, even though we know that activities exist, but it's suppressed. Okay. Then,
yeah, go on to the.
I should go on. Okay. All right. So, yeah, this is just a map showing like LGBT rights, across the world. We can do that later on. Okay, so we'll fast forward to elections, mental health. Okay, so there's election anxiety. And what is the main cause of the election anxiety? The main topics are coronavirus, the economy, lockdown, war on terrorism, joblessness, and so on. Then we have the partisan politics, civil unrest, conspiracy theories on TV, and the internet. So a survey done by Stress in America showed that 56% of Americans identified the 2020 elections as a significant stretcher. And the CDC also says there's been a 3 times increase in prevalence rates of anxiety symptoms compared to the same period last year. And all this is higher in young adults, Blacks, and Latinos. But we should be aware that the sources change. So throughout the year, the sources will change in their fleeting. So what was the cause of stress in May will not be the same cause of stress just before the elections. And it's quite interesting to know that, many individuals are extremely anxious, but others have subdued anxieties. They are not really outwardly displaying that they are anxious. And this allows those with the subdued anxieties to control and manipulate those who are really anxious. Also, those with subdued anxieties may decide not to vote and exercise their rights. Next slide, please. Okay, so continuing on elections and stress, we have this phenomenon called the elections stress disorder. It is not in DSM-5 or it's not in ICD-10, but it was first coined by a gentleman called Stephen Stossney, PhD in 2016. And he just noticed that his patients were complaining a lot about stress that was interfering with their livelihood in their personal lives, especially for these 2020 elections where the stakes are so high, okay, because the outcome of the elections can impact individuals, families, neighborhoods, regions, states, and so on. And these changes can be permanent or really, really, really long-term. Then, so there's also the negative information, the personal attacks, all these leads to heightened awareness. There's conflict between friends and families on both sides of the political divide. And how does election stress disorder manifest itself? Is mainly through insomnia, irritability, fear, hypervigilance, and actually fear of missing out on news. Okay, so and for susceptible people, this can actually progress to clinical anxiety and depression. And one of the main causes of the election stress disorder is the feeling that you are not in control. Like if the media is controlling you, the internet is controlling you, any information there, we are reacting to it. Reacting to it and so on. Okay, next slide, please. Okay, so elections and stress. Okay, so this year alone, 68% of US adults say elections is a significant stress in their lives, and this reflects an increase over the 52% that was seen in 2016. And it cuts across the whole political divide. Both Democrats, Republicans, Independents all felt that there was stress in their lives. Adults with chronic conditions, especially those with mental health conditions, experience even more stress as compared to the general population. And they saw that it was the results of the elections and the future consequences, which was the greatest source of stress. Next slide, please. Okay, so a small study, still continuing on elections and stress, a small study done amongst undergraduate students revealed that anxiety, stress, and poor sleep, okay, that happened the day of the election or immediately preceding the election was short-lived. So after about a week, you are done with it, you recover, and life goes on as usual. But other feelings like anger, fear, marginalization, discrimination, they increased just before voting and just after voting, and they tended to linger on for weeks and weeks, sometimes even months. Another study showed in Israel that involved about 118 voters showed that cortisol levels was almost 3 times baseline immediately before voting. That is, as the person was standing in the voting booth. Of course, the weeks prior there was, but the highest peak was seen as the person was in the voting. The person was in the voting booth, and this was the voters were aroused emotionally, positively by sharpness and inspiration, and negatively by nervousness and embarrassment. I guess depends on like who you are voting for. Okay, and we know that cortisol, stress hormone, affects decision-making process. It affects risk-taking behavior, and it also impedes and affects our memory. Okay, next slide, please. Okay, in another study that was done, okay, it was seen that people with higher baseline cortisol levels generally were not voting and have decreased political participation. They're actually apathetic to the whole political process. But on the other hand, individuals with low baseline cortisol levels were more likely to be assigned and seek out combat role. This studies was done during the Vietnam War, where they noticed that like young soldiers, those with low baseline cortisol levels, were they were more pro-war and they were more likely to accept like dangerous missions. Okay, so it was more or less these individuals getting a sense of control, a sense of thrill, and a sense of admiration to other people. Okay. Then we have this Golgotha rule. So it was implemented by the American Psychiatric Association in 1973 that prohibited psychiatrists from diagnosing and analyzing public figures. So during one of the U.S. presidential elections, one of the aspirants by Goldwater was said to be mentally unfit. Mentally unfit. So the Fact magazine did a poll, and encouraged psychiatrists to say whether he was fit to stand in office or not. Unfortunately for the psychiatrist, he sued the magazine and he won. So since then, that Goldwater rule has been implemented that no psychiatrist can diagnose any public figure, especially if you haven't seen the person in person. And the present circumstances that is happening kind of reminds us of this Goldwater rule, where a lot of people have different opinions about ex-President Trump. Okay, next slide, please. So for as far as voting is concerned, so the 79% of the American people thought economy was the main issue for voters. And this was followed by healthcare, the Supreme Court appointments, and the coronavirus outbreak. And even the coronavirus outbreak outperformed traditional voter issues like gun policy, immigration, and so on. Okay, next slide, please. Okay, so effect of elections on COVID-19. Okay, so a study done in Wisconsin health showed that when they were holding one of their presidential primaries, okay, 2 to 3 weeks later, there was an increase in COVID-19 positive test rates. And the study said for every 10% increase in in-person voters at the polling station, there was an 18.4 increase in COVID-19 positive test rates 2 to 3 weeks later. There was 26 individuals by President Trump, where there was no social distancing, no wearing of face mask, and so on. Okay, and it showed that for more than half of the president's 22 campaign rallies that were held around the country, more than half of them caused an increase in COVID-19 cases. Ironically, counties with lower COVID-19 incidents prior to the elections had a more visible increase. So if before the rallies you had very, very low, COVID-19 cases, after the elections you saw a spike in COVID-19 cases. And a similar study was done in France, where they showed that there was an increase in mortality about 5 weeks after municipal elections was held. It was also seen that in parts of France, after the lockdown, okay, it's kind of weird, but after the lockdown, when elections were being held, the tougher the lockdown procedures, the more likely that the citizens will vote for the incumbents, like the people already in power. There was one study that showed that in the state of Wisconsin, there was no increase in COVID-19 positive test rates after the presidential primaries, but that study was not peer-reviewed, so I didn't even include it in the slides at all. Okay, let's go on, please. Okay, so continuing on the effect of elections on COVID-19. So like I said, during one of its municipal elections, France recorded a very low voter turnout, 46% compared to 63.5% in 2014. A similar thing was seen in Iran, where there was a drop from 62% in 2016 to 43% as the time the parliamentary elections was going on. In the state of Illinois, there was also a 25% decrease in voter turnout compared to that seen in 2016. But for the states of Arizona and Florida, there was an increased turnout increase in voter turnout. It seems like a paradox, but it really is not, because in those states, they encouraged early voting and they encouraged mail-in ballot. So people actually stayed away from coming into the voting menu, and they actually cast in their ballots by mail. Okay, the main reasons for this was fear of infection. Okay, and this is a component of the COVID-19 stress syndrome. Next slide, please. Okay, so COVID-19 and election stress. Okay, so this is just a short preamble. It started in Wuhan in late 2019 and gradually spread to different parts of the world. So China has a total of 86,000 cases with 4,600 deaths. Okay, as compared to the US, which has 9.38 million cases and 242,000 deaths, despite the fact that the US had more time, prior knowledge, and everything to actually quell the increase of the COVID-19 cases. But we can theorize that China is an autocratic government. Anything that the leadership done is strictly adhered to, and they were able to stop the spread of the virus. Whilst the US, a more liberalized society, coupled that with an administration who didn't believe in the cause of the virus, thought the virus was a foreign disease, thought that face mask and social distancing was not scientific enough. Okay, so other causes of stress, election stress from the COVID-19 initially was the uncertainty of the cause of the virus, the mode of transmission, misinformation, disinformation, conspiracy theories, and so on. I'm sure we've all seen those WhatsApp messages that flew around about Bill Gates, the 5G towers, the vaccines, and so on. And also preventative measures to prevent the COVID-19 stress, okay, in itself causes anxiety and stress. So constantly washing your hands, constantly wearing a face mask, hand sanitizer, social distancing, and so on. These are not something that we are used to seeing. So anytime we see something like that, it causes us stress and anxiety. Don't touch your face mask. How many times have I not touched my face mask and suddenly remember that, oh, after touching your face mask, you have to sanitize your hands and so on. And also the constant bombardment of messages on social media, the internet, radio, billboards, and so on. All these will cause an already heightened level of awareness in the general population, which will also increase anxiety and which will also increase election stress. Okay, next slide, please. Okay, so still continuing. Oh, sorry, there was something with the formatting here. Okay, so still continuing with COVID-19 related stress. Okay, so family. Okay, so a study was done that involved like 3,000 participants for COVID-19 related stress. We found out that the main stresses was the family getting COVID-19, infecting others, the financial burden, getting COVID-19, dying from COVID-19, and then having COVID-19 in that order. I found it a bit weird that people were actually thinking of their family first and infecting others first before they actually thought of getting the COVID-19 themselves. Anyway, but this pattern has been fairly consistent. It has been replicated in other studies, and is stable between genders and between people, healthcare providers and non-healthcare providers. And we think this is caused by pro-social behavior, where in times of stress, we tend to get this nurturing behavior where we think of immediate family first, and then your immediate circle of friends. And it's an altruistic behavior which can build up resilience to overcome adversity later on. A similar study was done in Ghana and yielded the same results. Actually, this study was done by Dr. Ruth Owusu-Entwi and her colleagues. And it showed that in Ghana, the fear of infecting family members and close contacts, death and loss of income was among the top concerns of those living with the COVID-19 diagnosis. And those living with the diagnosis also experienced extreme feelings of loneliness, sadness, and alienation. Okay, next slide, please. Okay, so in another study that was done in the US that involved 6,800 people, they measured, so levels of stress was measured between those with anxiety-related disorders, mood-related disorders, and unaffected people. And the measurement was done using the COVID stress scale. So the COVID stress scales also provides enough evidence for the COVID-19 stress syndrome. Okay. And the parameters that were measured are the fear of becoming infected, the fear, fear of contact with infected surfaces, fear of foreigners carrying the disease, fear of social economic consequences, compulsive checking and reassurance, and traumatic stress symptoms, example, nightmares and intrusive thoughts. And 25% of the population using these tools, 28% of the population experienced elevated anxiety. And actually, 28% were experiencing clinical depression. This was comparable to the 25% of Chinese that experienced anxiety in the early stages of the coronavirus pandemic. Okay. Then the anxiety-related disorders exhibited higher CSS scores than the mood disorders. Okay, we can go on to the next slide. Okay, so this is just a brief historical perspective. So Joan of Arc, the Maid d'Orléans, during the 100 Years' War, she experienced, even at the age of 19, she experienced voices and visions of St. Michael, St. Margaret, and St. Catherine that told her to drive the English out of occupied France. Apparently, England was in France. So, and they were losing the war. They were losing the war massively. So she went to kill King Charles and convinced him that she can drive the English out of France. So apparently she was so convincing that she was made the head of the army, and she was victorious and drove the English out of occupied France. It's theorized that she probably had bipolar affective disorder and or temporal lobe epilepsy. And next, so all these are examples of how mental health can affect, can affect politics. Okay, so then the next person is Adolf Hitler, the Führer. I'm sure we've all heard of him. He was thought to have a conversion disorder, bipolar affective disorder, or schizophrenia. He's Austrian, German. He believed in the Iron Race, which is the superior race, the white Germans, tall, blue-eyed, muscular, well-built, and so on. He went on to conquer almost the whole of Europe and parts of Africa during World War II. In the process, he killed 6 million Jews, invalids, blacks, gypsies, and so on. Anybody who basically didn't fit the Iron picture was almost guaranteed to be eliminated. Okay, next slide, please. Okay, then the last one is Hans Asperger, from where we get the name Asperger syndrome. So he was a pediatrician, a eugenicist, medical theorist, and a professor. So he worked extensively with children with what we now know as autism spectrum disorder. Unfortunately, he worked in close collaboration with the Nazis, and in the process of developing his quote-unquote theories, he actually assisted in killing hundreds of disabled children. And he was quoted as saying that, unfortunately, the vast majority of cases of people with autism, even though they had positive behaviors, the positive behaviors do not outweigh the negative ones. Thank you, and this is the end of the presentation. My references follow. If there's any questions or contributions, I will be happy to take them.
Yeah, thanks a lot. That was a very engaging and exhaustive presentation.
Oh, thank you.
Very enlightening.
No, thank you, Dr. Korle-Bu.
Okay, so want to hear from the floor. You can unmute yourself and ask a couple of questions. Election and stress. We are just a few weeks or a few days away from election. So we should not be surprised if we start getting some of these election-induced stresses. Yeah, residents, any question? Psychologists, nurses, doctors. Sammy? Sammy, we can't hear you. Abigail, Albert, Comfort, Sheila, Edna, George. Okay.
Okay, so I probably totally bored everybody.
Oh, I don't think so.
Oh, okay.
Elections and are always very topical.
Oh, no, please.
Oh.
So it's very interesting.
Oh, okay. All right. Thank you.
Oh,
that was a good presentation, Doc. Well done.
Oh, thank you. Thank you, Dr. Asadoya.
I didn't realize Dr. Hini was not around. Okay.
Okay. Okay, can we move on? Or?
Oh yeah, so we can end.
Okay, all right. Okay, so in the absence of any further questions or contributions, I'll move that to end this presentation. Thanks everybody for coming, and we'll see you next time.
Thank you.
Okay, thank you.
Thank you.
Oh, there were 2 chats.